Good morning all. Welcome to Kerala Blockchain Academy. Today we will have the session by Dr. Jane Thomason on blockchain and pandemic response. So this is our fourth free webinar series this time. Hope you all are enjoying our webinar series. So I will not waste my time to give a very brief introduction. Dr. Jane Thomason, who is a well-known personality in the blockchain domain. In fact, she is the lead author of the famous book Blockchain Technologies for Global Social Change, and she is also recognized by the Forbes magazine as blockchain's leading social development evangelist. And Kerala Blockchain Academy is actually very happy to have her as in our advisory panel. In fact, she is serving as many key roles like the industry associate for Center of Blockchain Technology, University College London. Then she is a co-founder of British Blockchain Association and the Frontier Technology Association. In fact, the chief editor of one of the most popular journals in blockchain, the Blockchain for Good by the Frontiers in Blockchain. And she is also editorial board member of the Global Health Journal. So she is a well-recognized personality in the global blockchain domain. In fact, she is a health advisor to the World Health Organization, a digital transformation advisor to the Partnership of Maternal, Neonatal and Child Health sector. She is holding many positions in this blockchain domain as well as a healthcare and public good domain. So if I am going to speak about it, it will be a very lengthy session. Over to you, Jane. A very warm good morning to you from the state of Kerala. Hope you're safe.
Thank you very much, and hello everyone in Kerala. It's a pleasure to share some time with you and talk a little bit about blockchain and how it's been used in the pandemic response. I wanted to just start off with the profound changes that have been taking place during the pandemic, outside of the fact that we've been locked down, that there's tragedies surrounding us, that governments have become inward-looking, global supply chains have broken down. But one thing that we've actually seen is that COVID-19 has been a catalyst for digital acceleration. So anything that we can do digitally, we are doing digitally. And this is very relevant in the healthcare sector because the healthcare sector is one that's been highly regulated and tending to be resistant to change. So we've seen very rapid escalation of different digital platforms and blockchain platforms during the pandemic. And many people who were already working on certain blockchain solutions have pivoted to make their solution relevant to the pandemic. And the game-changing factor that has enabled this to be significant globally, of course, is connectivity. The fact that the majority of the world have access to mobile phones and that connectivity by the internet is growing rapidly. So what we've seen is that blockchain technology is being used in a number of different ways during the pandemic. The first one is understanding the pandemic and tracking its movement. The second one is managing the pandemic and exchanging data and using blockchain and other technologies for remote management, for diagnosis, for tracking the movement of people. The third one is supporting communities during the pandemic in various ways. And the fourth one is vaccine development and clinical trials. And I'll also talk about some non-healthcare but related examples of blockchain in areas like payments and donor and philanthropic funds flow, because these have also been important adjuncts to healthcare that have accelerated. So let's just start with mapping the pandemic. We've seen a number of blockchain solutions or existing platforms pivoting to support the management of the pandemic. So the first one is ACOR, which uses blockchain solutions to easily track the virus and visualize its spread using an app called Hashlog. The Hashlog dashboard allows researchers, scientists, and journalists to follow the spread of the virus and trends over time from public data, including data from CDC and WHO. And the blockchain technology ensures that every piece of shared information cannot be manipulated or changed. And this is very important in this era we live in of fake news. The second one is outbreak tracking. So WHO and other agencies have collaborated on a Me Passa platform, which is essentially a COVID-19 information highway, which is a Hasera consortium-based platform on Hyperledger Fabric, which I know a lot of people at KBA are familiar with. Tracking tools, the ACR blockchain, which I spoke about, tracks the virus and visualizes its spread. And then the other one is the immutability and censorship resistance, because we're in the era of fake news, manipulated data. So the Airweave Global Permaweb, to which anyone can contribute, can assist in ensuring that information can be retrieved permanently, even if it's censored from other platforms. In terms of managing the pandemic, probably the first thing that really struck us when we started to be impacted by the pandemic was the breakdown of supply chains with inadequate personal protective equipment. But also, when that shortage happened, we had a proliferation of fake PPE. So blockchain's facility to ensure integrity in healthcare supply chains has been incredibly valuable from the manufacturer to the patient. So Alipay, for example, has launched a blockchain-based platform that enables users to trace the demand and supply chains of medical supplies, including the recording and tracking of epidemic prevention materials such as masks, gloves, and other protective gear. Face masks in China during the early days of the pandemic, there was a dramatic gap which led to a rise in counterfeit production. Patient management, service delivery, and information is another area where blockchain has come to the fore, because blockchain can give patients easier access to and control over sharing their own medical data and enable different providers to access personal medical records or prescription history. And one of the things that we've seen is absolutely escalating collaboration between medical providers and a willingness to share data, perhaps on a scale that we haven't seen before. And blockchain's able to bring cohesion to an otherwise disparate and overly complicated system of delivering data across the entire healthcare spectrum. Tracking at-risk people is another area where a number of governments have been experimenting and trialling different platforms so that we're able to conduct digital contact tracing or be able to identify hotspots or map and track the movement of people back to their home provinces, perhaps in a city like New Delhi, which might have been shut down and people are trying to go home because they don't have a house because they're street dwellers. This is ways of watching the movement of those people and looking for at-risk hotspots. So blockchain has been used in a number of different ways to be able to create accurate databases with identity, population level testing and infection history without breaching privacy and allowing better data exchange. And some of you might have heard of the so-called experiments with the immunity passport in the early days of the pandemic. Although it seems unclear now whether in fact having had COVID-19 confers any immunity on you, people were looking at ways to be able to identify those who had had the virus and who may have some immunity, which would allow them free and open movement back into the population. So credentialing is another one which has become very important. And as I recall, KBA has been working on a blockchain credentialing application. So in a number of different ways, new health workers have to be brought back into service. And anyone who works in a hospital will understand that it's a very long and arduous process to credential a medical doctor, often taking up to a year and involving multiple outreach to universities and obtaining transcripts and so forth. So during a pandemic, you simply can't wait that long. So there's been work going on about using blockchain to assess the credentials and store the credentials of health workers. And ODEN is providing free access to its blockchain education and credentialing platform to educational institutions that are working virtually. And it allows educators to issue digital certificates of completion and achievement as they teach classes online. So this is particularly important where skills that might be important in the pandemic were needed, and people need rapid training in skills and certification that they've had that training. So again, on patient management, service delivery and information, a couple of examples here. One was rapid medical parts, which was a decentralized manufacturing practice in which customers can order and print parts, for example, medical devices, for use where and when they need them. So blockchain has ensured tamper-proof design and printing instructions. And in just 12 days, the Pentagon awarded this company a contract for converting sleep apnea machines into ventilators. The conversion required additional parts that Rapid Medical Parts will print, and at 1/10 of the cost of the new ventilator. So in this example, the other important piece of technology that played a role here, of course, was 3D printing. And all around the world, 3D printing has been used to print parts and other items that have been in short supply. So the other example that I have here for you is around data privacy. Civitas in Honduras. And what this does is lets medical professionals share confidential data that enables patients to travel to care facilities despite the stay-at-home orders. It allows police to verify if the patient has travel rights, and it allows the government to develop a more accurate and real-time data about the distribution of infection. So just in terms of preparedness for another pandemic, and I think many countries have learned difficult lessons by being completely ill-prepared for this pandemic. I think many countries are going to really review their supply chains, the stockpiles of personal protective equipment, and ensure that they have provenance in place for tracking of assets across supply chains. So this is an area where I think blockchain companies who've already developed that kind of technology are probably going to have good opportunities to be able to partner with governments to ensure the provenance of supply chains in the future. So we've got Alipay, which set up blockchain track and trace for medical supplies, and then Timeless, which maps and analyzes the medical supply chain for a blockchain-enabled decentralized marketplace. So I'm just picking out one or two projects that I've looked at that have pivoted and are working during the pandemic. Of course, people have been stuck at home, people have been afraid, people have been without information. And in many countries, people have lost trust in their governments and have lost trust in the news media from where they're getting their information. So trust really has been a major issue throughout the early months of the coronavirus pandemic. And getting accurate information is key to ensure the public are well informed. So blockchain can attach a pseudonymous path to the original material to ensure both the integrity and truthfulness of the data, while also ensuring that the privacy of the source is protected. Many people have lost their jobs during the pandemic. Many people will be forced into poverty during the pandemic. So there's been rapid movement from both donors, philanthropists, as well as some of the crypto exchanges and governments to be able to make social transfer, whether they're donations or whether they're government subsidies. So donation tracking through smart contracts is a really important application during the pandemic and will be important after the pandemic when we're in the recovery phase. Unfortunately, again, and I've mentioned this, there have been viral images and videos of donated supplies being taken by non-medical personnel, and this has caused an outreach on the social media. But using smart contracts, blockchain can ensure that donor funds and supplies can reach the intended recipients in a transparent way. And the smart contract can unlock a payment when a service is delivered to an intended recipient using a blockchain-enabled identity. And donors are going to be able to see where their funds are needed and then track them in real time until they're provided with a verification that their donations have been received and received by the intended beneficiaries. So that tracking and tracing and increasing the efficiency, speed and cost of funds from governments, donors and philanthropists to impacted populations, to the vulnerable, to small and medium-sized enterprises is a really important aspect of blockchain. And we're seeing already, I'm involved in the UK in a collaboration to take to the government propositions about using alternative payment mechanisms for their government subsidy programs. And many of them are using blockchain and smart contracts. So it's not just about what happens in the health system that matters in the pandemic. There are also things like I spoke about transmission of social payments, and there are insurance claims. So what we're seeing is that blockchain can mitigate the risk of infection from face-to-face contact as the platform is able to process transactions without human involvement. So Ant Financial and Xinghubao, a blockchain-based mutual aid platform in China, was started up that provides money to individuals for medical needs, and it added coronavirus to its list of critical conditions eligible for payout. And the Blue Cross Asia Pacific Insurance in Hong Kong has utilised its blockchain platform to reduce the amount of paperwork involved in health services. Blue Cross has said its blockchain-backed platform can automatically handle more than 1,000 concurrent transactions in a second. One of the other areas, and I put this in not because it's being used yet in any advanced way, but because one of the hottest topics that we have in the pandemic is wondering about when someone's going to invent a vaccine. I think it's worth understanding in the scope and scale of ways that blockchain can be used for healthcare and in the pandemic to think about clinical trials and surveillance. So for clinical trials, blockchain enables more transparent, checkable methodology for clinical trial integrity. It prevents data falsification because data integrity is ensured by the cryptographic validation of each transaction. It's traceable. Each transaction with blockchain is time-stamped. So if a particular action has to happen before another action, the evidence is there on the blockchain with the time stamping of when that action took place. Missing data, blockchain demonstrates how trust in clinical trials can be enforced and data manipulation eliminated. Blockchain smart contracts in many ways act as trusted administrators and provide an immutable record of trial history. In most, if not all, clinical trials involving human subjects, you must obtain consent. So blockchain enables data users control or differential privacy, data sharing, and community-driven clinical study. And if consent is obtained, again, this is time-stamped on the blockchain and it's evident that this took place. And so blockchain, of course, has a notarization functionality. Through posting a digest or a cryptographic hash of a text, data, or general purpose file to a blockchain database, it can be proven that this file or text existed at a certain time point. So blockchain really can facilitate clinical health data exchange and interoperability and cryptographically secured, and it's irrevocable. So it has a lot of applications in terms of future clinical trials, and this is relevant in terms of the vaccine trials that are being carried out now. Payments, even in a pandemic, things have to be paid for. So COVID-19 has accelerated thinking on retail deployment, including as a means to distribute urgent payments. Now, this can be the use of virtual assets themselves and or remittances supported by blockchain infrastructure. One that I've been working with in Britain is called BIPS, which is a global peer-to-peer economy with the transfer of value being executed over the blockchain using an asset-backed full reserve digital currency. And I think about a week ago, I was on a panel with Lee Burkett, who's the founder of BIPS, and they had made payments using the Bank of England payment rails. So they're ready to be able to send value immediately, fast, and as he said, at the cost of 1 penny per transaction, so very cheaply. Donations and philanthropy. Again, I've mentioned images of donated supplies being taken by non-medical personnel have caused outrage, and blockchain can ensure that donor funds reach intended recipients in a transparent way without intermediary leakage along the way. So a couple of examples that we've seen during COVID. Guangzhou-based startup called Hyperchain developed a donation tracking platform that already attracted 2 million in donations. And I think I obtained that information in March, so I'm sure it's a lot more now. Another platform which pivoted is called Munch, and this was building solutions to match philanthropy with sustainable development goal style projects in emerging economies. And Munch quickly pivoted to turn the focus of its philanthropy matching with projects that were going to help with COVID-19. So Munch had already built the core technology to allow KPI tracking and measuring impact at an individual, organisational, country and global level. And they're looking at changing the way people engage with charitable giving and impact investing worldwide. Because what they're doing is not only matching philanthropists with projects, but they're also using data to track and trace and report on impact against sustainable development goals. Insurance. So I've talked about a couple of these before, and financial, which has 104 million users, and they're allowed now to submit their documents while investigation firms get immediate access to them on the blockchain for COVID-related claims. And Blue Cross Asia Pacific is using their blockchain platform to reduce paperwork and can handle 1,000 concurrent transactions in a second, leading to swifter processing. And there were 20 other blockchain applications launched in China on COVID-19 over just 2 weeks in February, including an online screening system that securely manages health records and a platform that supports the management, allocation and donation of relief supplies. And then the Army Research Office in the US has launched a multi-university research initiative using game theory to examine the impact of incentives on behavioural collaboration among individuals, local governments, state governments and nations in the context of the COVID-19 pandemic. So just summarising that, and I'll be very happy to have some discussion and questions. So blockchain actually has really had, I guess, an acceleration and a growing legitimacy in the eyes of the health professions and to some extent governments, as it's been able to contribute in so many ways through information exchange, pandemic prediction, pandemic tracking, diagnostics, treatment and drug development, supply chain integrity and provenance, providing care at a distance, because everything that we've been doing has been trying to do it remotely, and then payments, tracking government bailouts and tracking charitable and philanthropic donations. It's worth stopping for a moment before I pause for questions to just think about some of the questions that are being thrown up, because essentially what I've just been through with you is a menu of the ways in which blockchain has been applied during the pandemic. But some of the questions we might ponder for the future is firstly in relation to global collaboration, because what we've all observed is that the global institutions that were set up after the Second World War at Bretton Woods have failed to provide the kind of leadership that's needed to help manage a global pandemic. Neither WHO, the UN, the G7, the G20, or any of these organisations have successfully been able to calm the waters, continuously provide guidance that's able to be used by governments to stem the pandemic. So one of the questions that I put to you and to other blockchain communities is, what is global collaboration going to look like after a disruption of this scale? Are the global organisations that we currently have in the world fit to be able to lead in this increasingly connected and digital future? And can blockchain, which with its capacity to create decentralised autonomous organisations and connect communities, researchers, coders, contributors, impacted communities into a network using some kind of token economics to incentivise people to behave well and to contribute to community agreed projects? Is this something that could be built to enable the kind of collaboration that we're going to need in the global future, remembering that we're in a world now where companies like Apple, Amazon, Google, Facebook, and some of the huge Chinese platform companies like Tencent and WeChat are more powerful than many governments. So who's going to be collaborating in this new decentralized future, and how is that collaboration going to be managed? The second one is, how has the pandemic changed consumer behaviours and expectations? So people are now at home. Telehealth has absolutely burgeoned. People are using artificial intelligence, virtual reality. They're shopping at home. They're ordering their food at home. They're learning at home. They're getting their education at home. So what changes do we have with consumers that are going to have to be sustained after the pandemic? So there are already a number of new care models that are being deployed to manage COVID. And then should these be maintained, and how will they be maintained in the healthcare system? Therefore, how will this change that COVID's brought about actually change the way that we manage and use our health? And one of the issues that I also want to just put in your minds is this issue around data sovereignty, people's individual ownership, use, and if you like, valuing their own health data, because there's been a lot of discussion and a lot of development going on about developing people's health data wallets that allow them to be able to give access to other people to their own health data. So data sovereignty, and then going down to point 5 around privacy and security, the questions of who owns the data, who can have access to the data, and how that data will be shared, and how that data can be accessed by government in an event where national security is concerned. So these are questions that we will be engaged in over the coming years. Number 4 is, how do we ensure operational readiness to deal with the pandemics of the future, including a potential surge? And we've already seen that many countries, if not most countries, were utterly unready for this pandemic and unprepared for this pandemic. So how can we be better prepared? How can we better be prospectively tracking the data and monitoring the data so we can look at outbreaks or hotspots and be able, in real time, and be able to respond to them? How do we rehabilitate supply chains to make sure that countries have access to PPE and so forth? And then finally, in terms of healthcare, I mentioned at the beginning that healthcare is a highly regulated and often resistant sector to change and to things like data sharing and other matters. Some of those legacy constraints have fallen away during the pandemic, and there's a lot of new collaborative behaviours that we've seen and that we should be valuing. But will things just return to normal? And if not, what will the new normal be like? So the question is, in your opinion, what are the chances to enable effective research collaborations between different governments? So I'm going to answer that in two ways. The first one is, we've seen a huge amount of research collaboration just coming out of the health sector and of the research community. A company called VerseIQ, which is a blockchain healthcare company, set up something called the Research Foundry and has basically made available all of its databases for anyone who wanted to access it for blockchain research. I think the issue about research collaborations between governments is slightly different. So we're definitely seeing research collaboration between academic institutions, between health institutions, and between researchers. I think one of the tough issues at the moment around governments and governance is they've all been absolutely consumed with just trying to slow the pandemic. And so their attention hasn't really been on the future. And it's really yet to see at what point that they're going to stop the immediate panic of the now and start thinking about what are the kinds of research collaborations or collaborations between countries that would be valuable to get engaged in. So what I think actually is the research collaboration is far more likely to come from the private sector and the research community first, and then at some point down the line that governments may well participate in a multi-country way. But what I am seeing is that governments are working with their own researchers and their own medical teams to be able to push forward advancements in technologies that they're going to be able to use now to solve their problems. Yes, well, I've seen there's someone who's talked about telemedicine and blockchain, and then someone who said how blockchain and AI technologies could be leveraged in combating misinformation spread during the pandemic. And in my slides, there was actually one example of that. If people would like a copy of my slides, I'm happy to share them, and then you can go and have a look at that particular project, because it was PermaWeb. You can have a look at that and explore exactly how they use the technology. But certainly this blockchain and secure data sharing is something that's got a lot of attention at the moment. And then just onto the telemedicine and blockchain, I haven't seen during the pandemic, particularly telemedicine and blockchain being used together, but I see immense potential. What we've seen is a massive escalation in the use of telemedicine, which is really interesting to me because we did the first telemedicine trial in Queensland, Australia, more than 20 years ago. At that time, I was the CEO of the Children's Hospital. And because Queensland's a very remote state and we had children all around the state, but most of the medical specialists were located in Brisbane. And it presented a challenge because either the medical specialists had to fly to very distant parts of the state, or the children and their families had to come to the hospital. And so what we were working on was whether, even though there would be some face-to-face visits, whether telemedicine could be used in the intervening times for consultations and discussions with the children and their families with the support of a local physician. And it was successful, but we haven't really seen a great escalation of it in Australia in a widespread way. But what has caused it to be so rapidly used now is because in our health insurance system, which we have, a payment number was given for telehealth consultations. So what that means is doctors get paid for telehealth consultations. So they were able to really rapidly increase the number of telehealth consultations. So my first comment about use of telehealth is it's like a lot of things in healthcare. Ultimately, someone has to pay for it, and working out a payment mechanism for it has clearly been one of the reasons why it has so rapidly spread here. But I think the second one, which is around blockchain, I would speculate that there are two ways that one could be looking at blockchain being used with telemedicine in the future. And one is obviously around the secure data sharing. But the other one, and I think we will start to see it, is going to be, you know, the tokenization, if you like, of the payment mechanisms with doctors and with other people who are conducting the telehealth consultations. I speculate, I haven't seen it, but I speculate that conglomerates of medical practices will begin to offer this kind of tokenized payment in exchange for a consultation. So there's one about blockchain and pandemic prediction. And look, I think that this is going to be really blockchain used in association with AI and big data analytics. And in fact, I'm in contact with, there's a student from St. Gitt's Engineering College who's working on cloud computing and working on exactly that problem, but it's more predictive analytics using big data than particularly using blockchain. But again, you know, I would expect that blockchain will be around that data sharing, interoperability aspect of it. But certainly people are working on these models right now. Oh, yes. Someone's asked about the medical domain doesn't permit it. Yes, exactly. But that was my point. And that's why I'm saying we mustn't lose the advances that have been achieved now, because it hasn't been allowed historically. But what we've seen in a lot of countries is if it can solve a problem, people have welcomed it. So there's been a lot more advancement in blockchain and other technologies during the pandemic. The question to be explored, and I've been on other panels where we talk about this, is which of these advances that have been made will be sustained. And we don't know the answer to that. But one of the things that I think is that consumer demand can put pressure on the medical community and on governments to change things. So if consumers have received, if they like receiving their education, or if they like participating in remote care and they can see that remote care could be better used as a way of keeping chronically ill people out of hospital and the elderly out of hospital, then consumers need to be demanding that. But every country has a different healthcare system with a different regulatory regime. And so I think it will, to some extent, depend on the particular country that we're working with. But I still think that what's important is where advances are made. And this is where I think the research community is important. These need to be documented and shared so that when the legacy system people say, where's the evidence? There is some evidence. And so I think research, industry and government have to work together very closely to get these advances in technology. Yeah, okay, there's a question about Chinese startups. So I think the first thing to say, well, I think I've got several things to say about China. The first one is China has a huge technology community and a huge blockchain community. I don't remember the number in my head, but I think it's probably got more blockchain startups and fintech startups than anywhere else in the world. Plus, they were the first ones to be impacted. So when I first started researching this presentation, it was in March. And then, of course, in March, most of the work that had been done at that point had been early work done in China. So that's my first comment. What's the chance of collaborating with pandemic-related research? I think that there's a lot of opportunity for collaboration. I'm actually on the editorial board of something called the Global Health Journal, which is the only English-speaking journal, medical journal that comes out of China. And I believe that the Chinese would welcome and are keen on collaboration. And I would think collaboration on technology is an area where there's a lot of opportunity. And I know a lot of work has been going on between different UK organisations, startups, co-working spaces and so forth, doing collaborative work in research on technology with China. So I think the opportunities are there. From a geopolitical point of view, I know that India and China aren't always the best of friends, so I can't comment on that. But I think there's certainly an openness in China to collaborating with outside researchers. But I want to say one other thing, because obviously I don't know who is in the audience, but what I've seen is globally calls for people who are doing research in any aspect of the pandemic. And there are research grants all around the place. People have funded hackathons to mobilise the technology community to come up with, initiatives that are going to be able to help manage the pandemic. Grand Challenges Canada, the Gates Foundation, they're all looking to fund great technology projects that deal with some aspects of the pandemic. So, I think it's a time, if you do have a platform, a project or a good idea, it's a time when people are reaching out and asking for these kinds of research ideas. So I don't know who's in the audience, but I encourage you to get out there with your idea, find partners to work with, and there's lots of opportunity to be able to advance technology at the moment in relation to the pandemic.
Normally, actually, in Mauritius regarding the blockchain, we don't have any regulation as such to justify the reason why people intend to invest in blockchain. So I would like.
I just clicked. Where are you?
Based in Mauritius.
Mauritius. Okay, you do have legislation about blockchain. And a very good friend of mine is working with the government of Mauritius on those regulations now.
Okay. So that's yes.
But you do.
Yeah, that's a great initiative because normally in Mauritius, that is, many financial institutions intend to have their business activities on blockchain. So it's more like very easy way to trade online to gain maximized profits. So that would be a better initiative if Mauritius could have certain legislation in place to encourage people to invest heavily in blockchain.
So what I can tell you, and if you give Ardesh your email address, I can send you that information. But Mauritius has been one of the jurisdictions that has actually been very forward-thinking in relation to blockchain and crypto regulations, and setting up the right kinds of structures for crypto regulation, and also wants to promote itself, if you like, as a leader in East Africa around blockchain and digital assets. So there's actually a lot been going on in Mauritius, and I believe they're considering at the moment a central bank digital currency as well. So I can certainly, provide the connections where you can get that information from.
Thank you.
Yeah, you're very welcome.
Thank you so much, Dr. Jane Thomason, for this wonderful session.